often hear about healthcare fraud as a massive financial drain or a regulatory headache. But what if the most devastating cost of fraud wasn't just measured in dollars, but also in patient lives? Not only does complex credentialing, billing, and telehealth schemes threaten our financial stability, they directly compromise patient safety and clinical integrity. To protect our healthcare systems, we must expose these illicit operations using rigorous forensic auditing and strict False Claims Act compliance. Let's dive into how we can identify these threats and address the impact of fraud on clinical and financial outcomes, protect our communities, and uphold the highest standard of nursing care despite compromised workloads and patient safety. The False Claims Act is a federal law that makes it illegal to knowingly submit fraudulent claims to government healthcare programs. Common violations include billing for services never rendered, clinical inflation, such as performing unnecessary procedures or overprescribing, upcoding to a higher billable rate, or unbundling services that should be billed under a single code and taking illegal kickbacks. The impact of these actions on a clinical setting is severe as it damages clinical integrity, erodes doctor-patient trust, and spikes compliance costs. To better manage these issues, we must strictly enforce anti-kickback and START laws. This requires holding violators to civil penalties and license revocations, focusing on continuous education and strict internal oversight, and encourage and protect whistleblowers.
Healthcare fraud is not just about money. From an ethical and a patient advocacy perspective, it directly affects patients' rights. It affects things like their trust, autonomy, and safety. When patients are misled or billed for services they did not receive, they lose their trust in the healthcare system. Fraud can also lead to unnecessary treatments, inaccurate medical records, and poor patient outcomes. Nurses play an important role as patients' advocates by documenting care honestly and protecting patients' rights. They're also responsible for reporting suspicious or unethical practices.
According to the National Healthcare Anti-Fraud Association, the U.S. loses in the tens of billions of dollars due to healthcare fraud annually. This results in higher premiums, increased out-of-pocket cost, reduced coverage, and increased cost burden to businesses wanting to provide employee healthcare benefits.
While healthcare fraud is often discussed in terms of financial losses, it also affects society, public trust, and healthcare policy. One major concern is its impact on Medicare and Medicaid, which provide healthcare coverage for millions of people. Fraud involving these programs can affect populations who rely on them for care. Healthcare fraud can also reduce public trust in the healthcare system. When cases of fraud occur, patients may lose confidence in healthcare organizations and how healthcare resources are being used. Because of these concerns, government agencies enforce anti-fraud laws and regulations to improve accountability and protect public funds. These challenges have also led to the creation of fraud prevention programs and new policies designed to protect healthcare resources and ensure they are used appropriately. Overall, healthcare fraud has a wide impact on society. By preventing fraud and promoting accountability, healthcare organizations and government agencies can help ensure that healthcare resources remain available for those who need them most.
While healthcare fraud is often viewed as a legal or financial issue, it also affects nurses at the bedside. First, efforts to prevent fraud increase administrative demands. Nurses may face additional documentation requirements, compliance monitoring, audits, and fraud prevention activities. These responsibilities create competing priorities for nurses and can reduce the amount of time available for direct patient care. As a result, nurses may spend less time at the bedside assessing, educating, and monitoring patients. A recent study by Kajui and colleagues found that workload demands and competing responsibilities contribute to missed nursing care, reinforcing concerns that increasing administrative requirements can affect nursing practice and the quality of patient care. Healthcare fraud also affects professional nursing practice by increasing the importance of accurate and truthful documentation. Nurses are accountable for ensuring that clinical records accurately reflect the care that was provided and for adhering to established standards of practice. These responsibilities support patient safety and help maintain the integrity of healthcare records. The American Nurses Association Code of Ethics further emphasizes the nurse's role in promoting professional integrity, advocating for ethical healthcare practices, and protecting the health and safety of patients. Because healthcare fraud can undermine trust, compromise documentation integrity, and divert resources away from patient care, nurses play an important role in supporting accountability and maintaining public trust in the profession. The key takeaway here is that healthcare fraud is not just a financial issue. It directly affects nursing workload, professional accountability, and the delivery of safe patient care. As we have discussed throughout this presentation, healthcare fraud impacts every level of healthcare. Clinically and legally, it violates regulations designed to protect patients and healthcare organizations. Ethically, it undermines trust and compromises patient advocacy. Financially, it increases costs and strains valuable healthcare resources. From a socio-political perspective, fraud can contribute to disparities and reduce public confidence in the healthcare system. Finally, it affects professional nursing practice by increasing workload, accountability, and patient safety concerns. Ultimately, healthcare fraud is not a victimless crime. Its consequences extend far beyond financial loss and the influence of patient outcomes, professional practice, healthcare resources, and public trust. Addressing healthcare fraud requires accountability, ethical decision-making, and a shared commitment to providing safe, high-quality patient care.